Well, talking about weight cause an eating disorder. The fear I hear most from parents is this: what if bringing this up makes things worse? It's a real risk, but so is staying silent. Let me show you how to navigate this with care. My name is Dr. Natalie Muth. I'm a board certified pediatrician, registered dietitian, and obesity medicine specialist. I spent 13 years in pediatric primary care, where I started a healthy weight clinic and had conversations like these with thousands of families over the years. I pivoted to start Namio Health to be able to provide more support and access to best practice programs and care around nutrition, physical activity, sleep, and overall health and well-being. So let me help you to navigate the conversation with your child and helping to better care for the concern of pediatric overweight or obesity. The research is clear that how you talk about weight with your child matters more than whether you talk about it. Having weight focused conversations or language that's really targeting a number on a scale or commenting on how a body looks, using words like fat or diet or restricting food, all of these things can be very harmful to a child and quite detrimental. And I really strongly recommend avoiding all of that. Let's not even talk about it in terms of weight. Let's talk about it more in terms of health, physical health, mental health, conversations that center on energy and sleep and how the body feels and how it functions. These are not only safe conversations to have, but they're even protective at helping to protect against developing disordered eating or a full-blown eating disorder. But staying silent and avoiding the issue doesn't protect kids. It just leaves them without a trusted adult to help them process what they're already experiencing. Kids at higher weights almost always know what they need is a parent, a caregiver who can talk about it without shame, who can be a support, an advocate, and a team member to make these changes all together as a family in a way that's fun. So the single biggest predictor of a healthy outcome for a child isn't whether parents address weight. It's whether the child feels supported and loved unconditionally while the conversation happens. You can hold both at the same time. I love you exactly as you are. And I also want to be here for you and help you so that you can feel your best. Let me help you. What would be the most important thing or the most helpful thing that I could do for you on this journey? Count on your child's pediatrician also to be on your team and on your side and to help you navigate this experience if you are working with a child who has increased weight or if you've been told that your child has a weight concern. There's lots of resources out there. Namio Health is one of them to really help support families in a healthy and positive way to make positive changes around things like nutrition, activity, sleep, and some behavior changes around mindfulness and stress management. But wherever you go, whoever you count on for help, make sure that you have credible supports in place and that your child feels supported, loved, and protected, and that everybody is making these changes together in a positive way. So tell me, have you had these conversations? Have you been concerned about disordered eating or heard your child say things that raise red flags for you? I'd love to hear what your experience has been, what's worked or what hasn't. Please drop your thoughts in the comments. Thank you.